Good morning. We're holding a second community briefing this week because of our local situation, which has moved beyond severe to extreme risk. And we have urgent information we need to share with you. And providing interpretation for us today is Margie Prop. Thank you, Margie, and thanks to everyone for joining us. Our data continues to head the wrong direction, and that includes the number of local COVID-19 patients' hospitalizations. The metric used for hospitalizations has been in red, the highest level, for 3 consecutive weeks, and it continues to increase. The 7-day rolling average of COVID patients hospitalized locally has increased from 113 on December 25th, which you can see on the chart, to 132 so far this week. Of those 132 patients, 97 or 73% were from Lancaster County. We've seen this percentage increasing over the past 2 weeks. On Wednesday, only 8% of our ICU beds were available. This is of great concern. Our COVID case numbers continue to increase at an unprecedented level. The 7-day rolling average of new daily cases was up to 536 on Wednesday, a new high. Last week, the number of new cases hit 2,900, an all-time high. This week, we're already over 3,000 with 2 days left to go. And I just learned that so far this morning, we have 1,013 cases just from this first download this morning. On Wednesday, we reported 736 cases, also a new daily high. Our positivity rate so far this week is now over 27.2%, also the highest on recent record. Schools are having to shift schedules, close classrooms, and close for periods of time. As you heard from Lincoln Public Schools earlier this morning, a high number of students and staff are not in school due to exposure or testing positive for the virus. Pius X High School is alternating its schedule, and at least 21 schools are experiencing absenteeism of 10% or more among students and staff. We're now feeling the full impact of the Omicron surge on top of still having Delta cases. Omicron is now the predominant strain of COVID in Nebraska. It's spreading extremely fast and causing a high number of cases in a very short time. This rapid spread is threatening our healthcare system, our schools, and our businesses. Additional action is necessary to help reduce the impact on our community. Today, we are announcing that we are reinstating the directed health measure, which includes the local indoor mask requirement. It applies to everyone ages 2 and older, regardless of vaccination status. It will go into effect just after midnight tonight and continue through February 11th. More information will be posted at covid19.lincoln.ne.gov. Along with the mask requirement, our local situation requires an urgent community response. For the next 4 weeks, go out only to go to work or school, to buy food or get medical care, or to get tested or vaccinated. Get vaccinated or boosted now. Avoid crowded situations, and don't attend big events. Get tested if you have symptoms or have been exposed to someone who has the virus. If you are sick, stay home and away from others. Wearing a mask and taking these actions will help preserve access to our hospitals and healthcare, keep our schools open, and reduce disruptions in business. The health department has worked closely with our community hospitals and medical professionals as we continue to face the extreme challenges brought on by this pandemic. Joining us today by Zoom is Dr. Eric Avery, president of the Lancaster County Medical Society, and he will provide an important perspective from the medical community. Welcome, Dr. Avery.
Thank you, Pat. Well, I guess I think we were all hoping not to be back here and doing this again, but on behalf of the Lancaster County Medical Society and the physicians who we represent throughout this area, thank you for letting us be here to speak today. 2022 has already been really an interesting year. It's only been 2 weeks, and we started with potential blizzard and frostbite warnings, and now people were wearing shorts yesterday. And yeah, now COVID is just the worst that it has been, quite frankly. I'm a little bit at a loss for words with some of this, but really I want to take this opportunity to speak quite clearly about what's going on. The hospitals are really full. The COVID cases are way too high. And it's up to us to do the right thing right now. No one wanted to go back to having to do things like this. And we have to do it from the standpoint of safety. And we fully support the mask mandate. With the mask mandate being implemented, it's just going back to those things that we know. Previously, we were able to pull back on the mask requirements because the vaccine availability was much better, the numbers were much better. And now we have to go back to those things that we know. Masks are proven to be effective in decreasing the transmission of viruses. Surgical masks are better than cloth masks. People continue to ask me basic questions about COVID because there's a lot of questions about all of these different things. But the masks, they're important, and that's not news to anybody. Everybody understands that. But better protection right now is needed for yourself, our loved ones, our neighbors, everyone that we're around in the community right now. I wanted to really focus on all the information that's really confusing right now. I hear people talking about, well, did I get tested for Omicron? Did I get tested for Delta? Is the death rate really worse for this one than that one? I heard somewhere that this is mild and this other new variant's coming out. Honestly, I would really recommend just stop. Some of that is getting so far into the weeds of the information that really the professionals really need to focus on that, and not necessarily you. And the reason why I would really say that is because there is so much information out there, and it is really confusing, and we need to leave this to the professionals. My colleagues and I do this day in, day out. We're trained specifically in medicine, and unless you're an epidemiologist and an infectious disease doctor, there's so many other fine details that we all just need to take a breath, stop and step back, and just think about those things that we all know are really important for us. So what do our doctors tell us? Well, let's go through the checklist. When we were kids, get your vaccines. Before you go to kindergarten, get your shots. They're proven, they're safe, they're effective. If you haven't already, get your COVID vaccine. If you're still hesitant, or if you have questions or you just haven't made time for it yet, call your doctor if you have any questions, but then go get your vaccine. We've all heard it. But then those other things are important. Take care of yourself. Exercise, eat right. Don't use nicotine and stay close to your ideal body weight. We don't talk about those things a lot because that's not what people are really asking about. But all of those things that we know that are good for us are still really important. Get your booster. I do keep hearing people say, well, I haven't got my third shot yet because I haven't had time for it. Or if it's the J&J, it's the second shot. Stop delaying. This is the time. We need to get it done. There are questions about, I heard on the news about this fourth shot that I'm supposed to get at 5 months, or is it 6 months? Again, just take a pause. And if you have a question, call your doctor or search the CDC booster guidelines. They're right there. Don't go to all the other websites and things like that. Go to the source. Let's keep going down that checklist. Right now, we all need to wear our masks indoors. It's the safe thing to do. It's the right thing to do for our fellow Nebraskans, for ourselves, for each other, for everyone we care about. Wear your seatbelt. I know that sounds really silly right now, but if you're in a car accident, if you're out of Lincoln right now and have a trauma that you need to come to Lincoln or Omaha, some of those are being turned away, not because we don't want to, but the bed situation is that difficult. We want to get everybody through. We want everybody to get taken care of. And we're not saying these things to scare you. We don't want people living in a bubble. We want you to live your lives, and we want to support our local businesses and each other, but we need to do it in a safe manner. So stop trying to figure all these minor, small things that you hear about in the news. Let's work together and listen to what the experts are saying. Right now, the entire medical field in Nebraska is telling us our hospitals are really full and the COVID cases are way too high and they're rising. You need to protect yourself. You need to protect others. And this is not just a Lincoln problem. This is not just a Lancaster County problem. This isn't even just a state problem or a region problem. We need to take care of all of ourselves, and we need to take care of our health. Hospitals are generally pretty darn full anyway, and if somebody has a heart attack or a stroke or a car accident or stomach bleeding episode, those things still happen every single day, and they usually keep the hospitals pretty full, but we are going to be in a very difficult situation if we don't all work together on this right now. Another thing that I'll tell you, symptoms, and we've all heard there's all sorts of different symptoms with these viruses. In my personal experience right now, I'll tell you, if you're telling yourself that you're dealing with your allergies right now because this is the time of the year that my allergies bother me, you should really reconsider, are those really allergies? A runny nose, a sinus infection for no reason? No, those are really concerning symptoms. And everybody that I'm testing right now with a runny nose or a sinus infection or even a lot of people with sore throats or a little cough, yeah, that's COVID. Get tested, and that's still important because we do need to know whether or not we need to isolate. You'll hear about PCR and rapid testing and antigen testing. Number one, get tested. If you can, PCR is better in my opinion, but just get tested so that we know, so we can isolate, so we can track and monitor that data, because that helps the community. We're not asking you again to live in fear. We're not asking you to live in a bubble, but wearing a mask, supporting our local businesses by, taking your dinner to go, curbside pickup, protecting others, getting your groceries, but just doing the right thing. It's the Nebraska way to do things. One of my colleagues who I really trust in this sent me a great message that said, if our neighbor's house was on fire, our entire neighborhood would show up to offer things and help and do anything we can. I don't quite want to say Nebraska's on fire or anything's on fire, but in all reality, the medical community and our family and our friends are at higher risk right now, and we need to band together to do the right thing. So wear your mask, get your shots, take care of yourself. The Lancaster County Medical Society strongly supports our health department so that we can protect our family, so we can protect our neighborhood, our community, our loved ones, and taking a measured approach reduces our risk. If you have questions, call your doctor, call a professional, and let us know if you have other questions or concerns. Thank you, Pat.
So each and every one of us contributes to the health and safety of this community, and our community needs us now.
Thank you, Director Lopez. Thank you, Dr. Avery, and thank you to all of you who are here with us today. Lincoln, our schools and our hospitals are in crisis, and they need us to act now. I'm asking anyone in a position of influence in this city to elevate these urgent messages of vigilance for the next several weeks in response to the crises our schools and healthcare system are experiencing in this moment. Pastors and other faith leaders, not only do you need to take precautions in your houses of worship, but in your sermons you can ask your congregations to take precautions in all aspects of their lives. There is no greater challenge in our community this week than the rapidly spreading Omicron variant that is threatening our schools and healthcare system. And you have the credibility to focus your members on the crisis at hand. To the members of the media, you have been incredibly valuable to this community through the pandemic, and your work has saved lives. Thank you. Until we relieve the burden on hospitals and schools, please amplify this message. I'm well aware that not everyone is listening to me speak right at this moment. So please help our residents understand the magnitude of our current situation, and please let them know the urgency with which they need to respond to this call to action. To anyone who is scheduled to host a civic club meeting, a wedding, a banquet, a luncheon, or any in-person event that is indoors but is not distanced and masked, particularly if it involves a meal where people typically remove their masks, consider postponing it until we are past this crisis. The sacrifice is small compared to what our frontline healthcare workers are experiencing right now. To all people hosting a gathering, if you're watching me right now, you know by now what spreads this virus. It is people in close proximity without masks, hoping no one near them is sick. Hoping isn't enough. The joy of gathering does not shield you from this virus. It's time to get real, and for at least the next 4 weeks, I'm asking you to make some tough decisions. Please follow the guidance of our healthcare professionals. Incorporate masks and distancing around anyone from outside your household. With the current numbers we have, we know that there's a good chance you will be exposed when you are out and about in our community. Take precautions, assuming that that is the case. We know so much more now than we did in the early days of the pandemic, and we've learned how to adapt, how to safely conduct essential business and government services, and to keep kids in the classroom where they belong. Please use everything we've learned to keep you and your loved ones as safe as possible at this time. To everyone who is vaccinated and boosted, thank you for shouldering the burden of protecting those who can't or won't do the same. Fortunately, you are 46 times less likely to be hospitalized for COVID-19 than someone who is not vaccinated. To those of you who are not vaccinated, maybe you're young and healthy, maybe you just don't see a need to do this for yourself, given that your own risk of severe disease is low. I am asking you to consider, if you don't see a need to get vaccinated for yourself, who would you get vaccinated for? Would you do it for your grandmother, an older coworker, your child's teacher, or a friend with asthma? Would you do it for Dr. Richmouth, Dr. Piper, Dr. Jarrett, Dr. Johnson, or the other pulmonologists, nurses, and healthcare professionals who have been working around the clock for over 2 years to help people in our community continue to breathe and recover from COVID-19? Our community needs everyone to help out right now. We're asking you to help out because your actions make a difference. Right now, your actions are vitally important to preserving access to hospital care, keeping kids in classrooms, and saving lives. And by taking action together right now, our community can and will get through this surge and be better on the other side.
Thank you, Mayor, and thanks to all who have joined us today. And now I'm happy to take any questions.
This is Bailey with 1011. Will the city be enforcing the mask mandate, issuing any kinds of citations or anything for places that are not complying?
You know, Bailey, we'll continue the process that we've used all along and doing education, working with locations, and then we'll proceed from there if there's not compliance.
Bailey again. We see comments on Facebook all of the time with people asking if 65% of the county is vaccinated, why are cases continuing to rise? Just what would be your response to those people?
Well, I would respond that 35% of our community that can be vaccinated isn't. And as long as we continue along that path, there's going to be new variants and more cases and more illness. And even at that, there are situations, just think about influenza and other things. It doesn't mean that you won't get the disease, but it will be much milder. And I think the mayor gave the perfect example of what happens if you're vaccinated and you become infected versus when you're not vaccinated.
Do you have numbers on how many tests are being done at the new city testing site at the Graham Tire?
Well, I do, but I don't have the number right now. I know that we did over 250 tests yesterday. And they will continue to increase the number of tests that they're doing there as they are ramping up and getting more staffing in there. We will reach a higher level of providing that. And NAMI does have their other location open, their other tent, so they have 2 drive-throughs. So we've been able to do a remarkable increase in testing availability.
Okay, Pat, we have a question from KLIN. Do you have statistics on the number of vaccinated individuals that are testing positive for COVID-19?
I know that on my last check, those that were boosted, who had a booster, represent only 10% of the population that's vaccinated as having COVID. Go ahead, Andrew.
Can you reiterate your the mandate that's going in right now, and what was the tipping point of why you wanted to do this, and why you didn't do this earlier, I guess?
I think the tipping point was we moved from the orange category in hospitalizations. We have a surge plan for hospitalizations, and we moved from that orange area to what we were showing on here to being in red this whole time. And our hospitalization average continues to increase greatly. And also, I can share with you, I talk with all our health directors across the district. We are hearing now when we have so many Lancaster County patients in the hospital, that means they aren't able to transfer other patients here. And our hospitals really are not able to take transfers from those hospitals. There are surgeries being performed in these smaller hospitals that they're not equipped to do, but it's the only option for them. We have people being transported from one end of our state to another. And some of those people are not able to survive. So looking at our hospital numbers where we're at is really important because we know the impact it's having on our community, just looking at those hospitalization numbers and then looking at our cases, our absenteeism in the schools. All of those things are considered. And I think we have to be able to have our hospitals available, and I think Dr. Avery made this really clear in some example, is that our hospitals are taking care of everyone. So if you have a heart attack, we want you to be able to go here. We don't want you to be transferred to Scottsbluff or another place, maybe even in another state to get care. And that's why. That's where we're at in Lincoln now. And I think Brian announced yesterday they've instituted additional components of what they're doing to reduce surgeries and that. So all of that led to where we are. That wasn't where we were a few weeks ago, but that's where we are now.
We do have a similar question from William Bauer explaining the rationale behind dropping the mandate a month ago to bringing it back now. Anything else you want to add on that, Pat?
No, I think I've shared why.
Okay. We have a question from Jeremiah. Will the city ask UNL to make any changes to its policies in the wake of the reinstated mandate?
UNL always works together with us very clearly. They, at our request, had already provided that there would be masking guidance. They are testing 100% of everyone returning to the classes after the holiday. We're making adjustments. We continue to work with them and adjust. I think we've all seen that we have to pivot quickly at times based on our community situation. Not only has UNL been a great partner, but so has Union College, Southeast Community College, Doane, and Wesleyan have done a fabulous job of wanting to keep their students and their staff safe and productive in the classroom, and we continue to work and support them. Andrew?
Right now, many of your you're strongly recommending, gatherings and things like that. At what point, or how close are you to implementing a DHM on restricting capacity on indoor events?
That's something that is a tool that's in the toolbox and can be looked at. I think it's going to depend on what our community response is now and where we're at going forward. Remember, we're trying to protect our healthcare system and have it available.
And
Pat, are you working with any other school in the community on plans for what would happen if they have too many cases or not enough staff? I know you worked with LPS on the plan they dropped this morning.
I'm glad you asked that, Bailey, because I do want to make it clear. We work with every school in the city of Lincoln and the county of Lancaster, and we meet with those administrators weekly. We talk with them frequently. Their staff work with our staff. We provide guidance. Their reporting. We have a surveillance system that was in place before COVID ever came about. So working with the schools in our community has always been a priority, all our schools.
the governor just issued a DHM, and it's for Nebraska medicine when they implemented the crisis standard of care. What concerns do you have about that?
Well, I think it's saying, Omaha and Lincoln are two major centers for being able to receive patients and care for them. And we do a lot of work with Omaha, taking care of people that need care as they do with us. So it is a concern. I know that our hospitals are closely watching that, about where we're at, and we're closely monitoring, I know the hospitals specifically are, what kind of impact that may have on our local situation as well.
Do you worry about a DHM that says you can't do these surgeries? I mean, if you implement, it sounds like many of these surgeries haven't been done anyway, but what message does that send to hospitals?
Well, I think, already our hospitals aren't doing surgeries, many of them, unless they're really emergent and needed because of the strain on the system and their staff. So at this point, they're not, I just saw the DHM before I came down here. So I'm giving a really quick answer on it from a quick read, but it's not denying emergent care or I'll just say emergency care to be really clear. So emergency surgeries would still happen, and that is critical. But unfortunately, people are having to put off some things now so long that they are becoming an emergency and they have to have that care.
I had a question from KLIN. Given the continued rise in cases, is the health department anticipating any additional vaccination clinics or additional testing expansions? And I think you mentioned that the new site is going to be ramping up.
Yeah. And I know that there are other sites increasing their testing capability. I'm working with providing physicians in our community to be able, some of our large group practices, to be able to provide testing in their offices as well. And vaccination clinics, we have a vaccination clinic almost every day. The health department's open. We've gone out. This week we were at Elliott, Arnold, and Clinton schools. Had a great turnout from families. So we're going into more neighborhoods to make it easier for people to get in and get care. But I can tell you at the health department, it's always busy with people coming in and getting vaccinated. So I really appreciate our community responding.
Do you have data on how many new people have initiated vaccination in the last couple of weeks?
I don't have that with me, but that is something I check every day. But I did not check that this morning, Bailey, so I can't answer that.
And Bailey, we post that, the number of people initiating vaccinations changes every day on the dashboard, so you may be able to get some information from that. Another question from William Bauer. Are you getting any pressure from the state regarding the mandate?
No, I haven't spoken with the state about it. I think the important thing is that we are able to respond to our local community needs, and that has been critical for us this entire time during the pandemic, as well as with other issues. That ability to respond from a local level to our local needs is really critical because we best know what our local situation is. Yeah, Andrew.
You've talked to, the hospitals in this district. How concerned are they that they may have to go to a crisis standard of care as well if these numbers don't turn around?
They're very concerned. We talk about that. I meet with our hospitals weekly to review where we're at, where we can take pressures off, where we have needs that we need to meet, and they are continuously monitoring what's happening. And I think, the mayor was mentioning some of it too, but one of my colleagues used the word, our brothers and sisters in healthcare are tired. They're weary, and they're doing their very best to take care of people. And as a nurse who worked in the hospital, when you lose a patient, when a patient dies, it's extremely difficult. Just like I know that's what some of our firefighters go through and our police officers. So when you do that, and maybe that would happen on occasion, and you could see the loved ones and the suffering that person went through, imagine if you're seeing that multiple times a day, every day, 7 days a week. And you can start to understand where they're at, trying to provide the best level of care. We need to help them.
Hi Pat, it's Matt Olberding from the Drill Star.
Hi,
Can you hear
Matt.
me?
Yeah, I can.
Yeah.
Hi, Matt.
I was just curious, in a lot of places, the Omicron wave has kind of hit really hard, and then gone away after 4 or 5 weeks. Have you guys had any talk to the state or had anybody locally do any modeling as to what you expect, over the next 2 or 3 weeks?
We do look at modeling, Matt. Even, locally here, we've done modeling, and then working across the state and looking at nationally. But, part of the thing that happened is, of course, it's coming later to us, and we watch that. But what we have seen with Delta has been a little bit different than what we saw happening in other areas nationally. And, I think it's important that we have to take in the vaccination rate, all those other factors in it. But yes, we're looking at that. So we're a couple weeks into this with Omicron. But a key thing to remember here is we're still dealing with Delta as well.
Okay, thanks.
Pat, just wanted to add, we had the question earlier about enforcement of the mask mandate. We'll be sending out a news release shortly, and that will have information on reporting violations. We ask people, please do not call the police department or the emergency 911 number to report those. You can report violations of the mask mandate through the Uplink app, and that information will be in the news release.
Yep. Thank you, Diane. I meant to tell that to Bailey, so thank you for saying that. Okay. All right. Thank you all for joining us today. Please be safe, wear a mask, and avoid crowded areas.